Dr. Genevieve. My name is Lisa Medina. I've been with Dr. Tim since August of 2006. I'm his office manager as well as a registered dental assistant. I have a wonderful husband and two boys, a 2-year-old and a 7-year-old. Dr. Tim kind of mentioned to us yesterday we were going to make a little video for you guys, so let's head on in and meet the team and we'll take a tour of the office.
Hi, my name is Melissa. I'm the administrative assistant for Texas Pediatric Dentistry. I have been working with Dr. Tim for almost about a year, and my duties are to check in and out patients and also to schedule appointments and also other duties. I have a beautiful daughter. Her name is Ariana, and a loving husband who I love very much. And
all right, well, we'll come right over here. We also have video games for the kiddos to kind of play with until we take them back for treatment or cleanings. Right over here, whenever we were getting our furniture, we wanted something cozy, like if the patients and parents were at home, to kind of make them feel comfortable. We also have a coffee station since Dr. Tim has to have his coffee, as well as hot cocoa in the wintertime for the kiddos. We'll head on right over here. We do have toys and stuff for the kiddos to get prizes and stuff once they're done with their appointments. Right through here.
Okay, can I put you on hold for a second?
He's kind of busy right now, but that's a good thing. We have Don.
Hi, I'm Don, Tim's dad. I've been involved in this operation here since the very beginning, I guess. And I've been working with Tim here for about the last 6 months, doing all types of odd jobs. Currently I'm doing all the EOBs, making sure that the insurance payments are balanced with our accounts, and making appropriate adjustments. I also am the primary monitor of the TV system, and the girls let me know whenever the movie's going off so I can reset it. It's a favorite of the kids, and that's about what I do. Look forward to meeting you.
All right, we'll come right over here. Dr. Tim actually recently did some construction to the office, which we love. He put in a door for us as well as a little control panel. It kind of helps us with the flow with the kiddos and the parents to kind of keep them going back and forth. Okay. So we'll come right through here. We're going to head on into our consult room right now, where we'll meet Beth.
Hi, Dr. Arron. I'm Beth, and I've worked for Dr. Tim temporarily over the past year until this last February when he asked me to join his staff full-time. And I'm married to my husband, Red. We have 3 lovely children, one of which is my daughter, Amber. She works here, and you'll meet her shortly. I am a registered dental assistant, and I help out in the back some with sterilization and x-rays, and call on insurance, and help at the front desk some with checking in and out the patients, just wherever I'm really basically needed most for the day. So I look forward to meeting you and your wife.
All right, Dr. Arron, we're going to come right over here to our op room. We do have 2 op rooms. We'll head on to our op 1 right now. We'll meet our clinical coordinator, Amber.
Hello, Dr. Arron. I'm Amber. I'm the clinical coordinator. I'm a dental assistant. I've been working here at the office for about 1.5 years now. My husband's a firefighter. We have no children yet, but hope to soon. In the meantime, we've got a couple puppies that keep us busy, so that's our practice there for you. This is our large op here. As you can see, we've got 1 chair now, but we plan to expand and put another chair in here. We think it'll just really help us better utilize the area, and that way we can have 2 kiddos in here at the same time. We do a lot of ops where we have brothers and sisters, so it might be more convenient to have them in the same room here, so we can have 1 assistant back here monitoring nitrous as well. If you look up, we've got TVs above all of our chairs here. They're a great distraction for the kiddos as well as a good behavior management tool. So I don't know how we ever worked without those things. We also use this operatory for exams, so we have a lot of tools to help teach the kiddos how to keep their teeth healthy. So we've got Al for the little kiddos, teach them how to brush. We've got other tools for the older ones. Our Totally Gross and Cool Mouth book, you'll see that helps give incentive for the older guys teach them how to brush there. So that's kind of a tour of our large op over here. We can sneak a peek next door if you want to come with me. We've got another one, pretty much the same thing in here, just a little bit smaller.
Okay.
So we use this for ops and exams as well. And we'll head down the hall here. I want to show you our sterilization area. Right through here. So we've got our lab area here. This is where we pour up our models before we send them out or have Dr. Tim work on them. So this is our lab area. Right over here is our sterilization area. We've got our ultrasonic here. We've got our cold sterile as well as our large sterilization right here. This side over here, this is our sterile side. So this is where we put all of our trays together as well as store all of our supplies. We've got lots of storage here. So that is this room. I'll walk you guys next door over here to our x-rays. Excuse me. So we've got our intraoral x-ray head here, as well as our piano machine right over here. We do use the phosphorus film right here. It's just a lot easier for the kiddos. Fits in their mouth a little bit better. We've got, let's see, we've got samples of all the x-rays that we take. So back here by the piano, we've got a sample of a piano up on the wall. It helps us better explain what we're going to do. We've got samples of our occlusals and our bite wings here as well, so that way we can tell the kids what pictures we're taking, why we take the pictures, all that good stuff. We have our little camera here that we use that to take pictures of the kids, so we keep them on file so when they come back to visit us we can just pop a picture up. Helps us better remember that kid. We are all digital x-rays as well. So, and that is that. So I hope to meet you soon. Bye.
All right, Dr. Aaron, we're going to head right on over here to our hygiene bay where we have Rebel, our hygienist.
Hi there, I'm Rebel. I'm the hygienist. I'm the newest member of the team here, and I've been a hygienist for about 2 years. I worked in dentistry for about 12 years. I started as a sterilization assistant for an endodontist and just worked in different specialties. I guess my favorite job would have been whenever I was an assistant for an orthodontist. For about 5 years I learned a lot about orthodontics, and that's helped me a lot here. So I'm married with 2 dogs. My husband's going to school for his degree in education, and we live about half an hour from here, so I'm pretty happy. Come on in here. I want you to see our hygiene bay. This room is pretty new. We just started using it, so it's still in transition, but as you can see, it's very open. We have this great view back here, this creek and all these trees. The sun gets a little bright in the morning, so we're probably going to put some shades on those windows later on. And on these opposite walls, we've been gathering some t-shirts from the area schools, and we're going to post them up on the walls to show our support. So these 3 hygiene areas are identical. This room is ideal for taking care of families, so everyone can kind of spread out. Or if we see, more than one patient at a time, we can see them back here as well. So we have these pedo benches, and this doesn't move up or down. Dr. Tim made these for us, and it helps to reduce their anxiety because they just climb on and lay down. So they don't have to deal with it moving around. And whenever they look up, they can see the television. It's playing the TV. And we also have these recessed outer lights, and they're controlled with a remote control. And so that helps us kind of focus in on some of those spots. So back here, I take care of the cleanings and fluoride treatments with the fluoride varnish or fluoride trays. We place sealants and talk to the kids and the parents about oral hygiene. So I look forward to meeting you.
All right, we will head on back right over here to our staff lounge. Beth has another office in here as well. We have our staff lounge over here and Dr. Tim's lab area where he does do some work for us as well. Beth's table where she does call and verify insurance and help answer phones if need be. Right through here, we do have our staff bathroom, as well as storage for extra toys or anything that Amber might need to store in here. So I look forward to meeting you, Dr. Aaron and Dr. Genevieve.